Welcome to Business English Solutions with Gift Chidi Omta. On today's episode, we are going to look at effective communication in health and social care setting. Remember, this is one of the courses or one of the topics required for an MVQ3 in health and social care or adult health care. So today we are going to look at what constitutes effective communication and why it's very important. Effective communication in the care setting is very important because it ensures accurate information is shared and it reduces risk of errors and helps deliver safe, high quality care to patients. One of the factors that promotes effective communication is clarity. Effective communication must be simple, must be clear and free from jargon to ensure that both our patients, our service users, and our colleagues fully understand our message. I'll give you an instance. If a healthcare worker, says take analgesics twice daily, the word analgesics is a jargon. You could use pain relief tab to replace analgesics to ensure that the service user or the patient understands what is being communicated to the person. And by so doing, you reduce confusion and reduce errors. Active listening and patience are very important to promote effective communication. You must pay full attention to whoever you're communicating with. Effective communication involves that we promote mutual understanding between both parties that are communicating. So individuals with learning disability, autism, and dementia finding difficult to process information is usually slow. So when we are communicating with them, we ensure that we are patient, we actively listen to them, allow them enough time to process information, and try to use one word or two word sentences to communicate to them. So when you are communicating with people who are nonverbal, you must use things like flashcards, visual charts to explain routines and to help them to understand. Then it helps you to, when they make any complaint, try to follow up with further questions. Asking follow-up questions, will help you to understand what the real issue is. It's not just by guessing or trying to assume what they are not really communicating. Then there are so many methods in communication. We have the verbal, the non-verbal, written, visual, and digital. So you must use appropriate communication methods if you want to be effective in your method of communication. Ensure that you use a particular method that would match the person's needs. When you are speaking to someone with dementia or with learning disability, use the appropriate communication method that will meet the individual's needs. Then we need to show empathy and respect. Effective communication must be courteous, respectful, show empathy, and show understanding of the patient or the service user's feelings. When they communicate a particular need, just reassure them that you understand what they're going through and that you are there to help them. And ensure you maintain eye contact and gentle tone to show compassion. Feedback is very important when it comes to effective communication. Communication is effective when there is feedback to confirm the message has been understood correctly. So after giving instruction, you could ask the person to repeat what you say or to use keywords, to ensure that there is no miscommunication and there is no mistake. So in summary, effective communication in the care setting is achieved by being clear and simple, by listening actively, using appropriate communication methods to meet the individual needs, show empathy, and check understanding through feedback. These practices help to promote person-centered care, reduce errors, and build trust with both the patient and the service users. If you have any issue, any question regarding this particular topic, feel free to send me email using Business English Solutions 6 at gmail.com. Remember to like and share and wait for our next topic. Have a good night rest. Bye.